laparoscopic surgery is in itself just an amazing way of doing surgery, and adding the 3D Da Vinci makes it even more fascinating. Risk factors for surgery, of course, there's always the risk if you don't do surgery that you could have complications or continued growth of certain things that shouldn't be there. But I always give the possibility of a 1%, roughly, the likelihood of putting a hole in the bladder or the ureter. Now, I do look into the bladder after surgery, after giving you a dye that would make your urine orange. So I'm looking for the ureteral jets, which are basically the pipes that empty the kidneys into the bladder. So if I see that, I see a really good shot of orange urine coming out in your bladder, and I look around your bladder, I know that at least at this time, I'm not seeing anything that would be a problem. The likelihood of having a bowel injury also is less than 1%. Blood loss with Da Vinci is also less than conventional as well as open surgery because you're seeing the blood vessels threefold magnified. So we usually work in the avascular planes, the planes that don't have blood vessels, to reduce not only blood loss, but also reduce the possibility of complications, staying away from major organs, and also to reduce traumatizing your tissue, so your postoperative pain is less. So the likelihood of that is small. Blood loss is less. The likelihood of having an abscess or something after you've had a blood collection is less than 1%. We do give you antibiotics preoperatively to reduce the likelihood of infection. And we also put stockings on your legs that compress the blood flow back up in order to reduce the likelihood of blood clots.